Hello, you guys. So, have you ever noticed this? Like, one week it's your neck that's bugging you, and the next week it's your shoulder, and then it seems to move to your low back, and maybe it's back to your neck again, and suddenly your jaw's tightening up, and you think, what is going on in my body? And you stretch one area, or you start working it out, or you pay attention, and it improves, and then something else starts hurting. It can feel so random and kind of unpredictable, almost like untrustworthy. What is happening? But what if your pain isn't random? It's actually moving for a really good reason. Well, today I want to show you why pain often moves, especially through the shoulders, the neck, the jaw, the upper back. And how it can connect to the lower body, I'll do in a later time. But let's just focus there and how your breath and your eye movement, your whole nervous system is always quietly assessing it and determining where tension's going to land next. So by the end of this, I hope you feel less confused, less kind of betrayed by a body because they really are built to serve, and a little more curious. I'm Dr. Melanie Carlone. I'm a somatic physical therapist, a yoga instructor, breath educator, somebody who's really jazzed on the nervous system for many years. I've been practicing clinical physical therapy for over 40 years, a master's and a doctorate, kind of a fool for punishment, and a dual 200-hour yoga certification, which I love bringing in. I work with people living with chronic pain, bracing, fatigue, inflammation. Histories of trauma are almost always behind a lot of the chronic stuff, and stress overload happens automatically, especially by those who feel unseen or under-supported by conventional medicine. And if we ever needed more support, which is why I do Why It Hurts and How to Heal, we need it now, because getting advice that's actually coming from people who know what they're talking about and being able to do it easily without cost is critical. So in this episode, we're going to unpack why does pain move and what can you do about it. So if your symptoms have been shifting from your neck to your jaw to your shoulder to your upper back, between your shoulder blades down to your hips, this one's for you. So pain isn't random, it's protective. Most people are taught or think about pain the way we think about everything is that it's isolated in one area. It's local. If you can fix that, you fix the problem. My neck hurts, it must be the neck. My jaw hurts, oh, it must be stress, or I'm grinding my teeth, or I have a problem with one of my teeth. My shoulder's hurting, maybe I just slept wrong, or I kinked myself. But your body is not a collection of parts. It's this like regulated symphony. It's a whole system. And your nervous system is constantly adapting and adjusting the tone of your muscles. It's designed to redistribute load, to manage the effort you're doing. So when pain migrates, it's rarely chaos, it's adaptation. And your system is feeling the stress and saying, where can I put this tension now? And that brings up something deeper. If the pain is actually protection, you need to ask, what am I protecting from? You see, underneath muscle is this incredible interconnected web of acellular tissue called fascia. Your jaw connects to the neck to the ribs down through the diaphragm, the musculature into your pelvis. Tension travels along these pathways. So if you're working at a desk and your head's drifting forward and your eyes orient downward, your whole neck is organizing around that visual focus. Your jaw has to tighten to stabilize the forward pull, right? If your breath is always up here high in your chest, your shoulders are trying to assist it. Your scaling muscles, which you may have heard before, really difficult to stretch or to get to let go, they're trying to assist this upper respiratory breathing, trying to keep you ready. And if your ribs aren't able to expand fully, then your mid-back is starting to stiffen. So eventually one region starts to fatigue and that load begins to move around, and then the pain moves around. Not because you're broken, because your system is reallocating the effort. So instead of trying to address things by stretching harder or work them out, what if you could actually get to the root cause to teach the nervous system how to reorganize its tone? Here's something most people don't realize. Your eyes help organize your neck and your shoulders, and your breath has a lot to do with how it organizes your ribs, your mid and your lower back. And the nervous system's organizing the muscle tone around all of it. So where your head goes, your eyes subtly follow. Where your eyes go, your head wants to move towards. Where your breath moves, your spine responds. If you inhale to lift the upper part of the body, the rib cage, your neck braces. Try it. Breathe up into your upper chest. Put your hands here and just breathe here. Feel your shoulders engage? They engage right away. And over time, if you're breathing that way, that becomes a tone pattern. And tone, that higher muscle activity, becomes posture. And posture becomes load, and load can become pain. So instead of trying to pull tissue out or force it, we're going to teach the system how to contract and then lengthen with control. That's how somatics works. Contracting around the protector and then releasing it with conscious awareness. Then the active part of your conscious brain resets the lower, more primitive muscle tensioning part of the brain. It's a brilliant strategy. You just kind of have to learn how to do it. So it's not stretching. It's listening, tuning in, giving the tension a voice, and reorganizing. All right, so let's try this. Just sit comfortably or stand. And first, just notice your breath. Don't try to change it. Just notice. Notice when you breathe where the breath starts from. Is it the whole bottom of the rib cage? Is it more up here? Is it more in your abdomen? Just notice. Now we're going to use breath, and we're going to come back to the breath afterwards to see the change, but we're going to use it in this way. Bring your right hand across your body to your upper shoulder. Curl your fingers in and hold firmly. Create like a deliberate contraction of your hand you're pulling, and feel the shoulder engage. Now inhale into the back ribs, the ribs behind you. Let the rib cage expand behind you and slowly exhale. Okay. And inhale again, low back ribs. You're feeling it now. And as you exhale, you're going to gently pull that shoulder down to your opposite hip. Let your eyes go down, opposite hip, pull your shoulder. Your arm kind of falls forward between your legs. And now you're going to let your eyes come up, your head come up, your shoulder come up. Keep pulling with your hand, but you're moving against the resistance. Let your arm come up. Squeeze your scapula, your shoulder blade, into your back pocket. Breathe, look up. And now let your hand that's pulling overcome and bring you back down again. And let your hand follow across the body down to your opposite hip. Okay? Let's try it on the other side. But just notice actually the difference. Feel the difference in the side of your neck, your jaw, just doing that. Okay, keep your sit bones even. It's only the upper spine that's going to curl. And you're going to let your eyes follow the direction of your hand. So reach across, grab your opposite shoulder, dig your fingers in, and then pull the shoulder down. Keep your sit bones even. Pull the upper chest down to the opposite hip. And now your eyes are looking down towards the hip. Let your eyes come up. Let your head follow. Deep inhalation. Let your arm come up. Pull your shoulder blade to your back pocket. Reach up, look up, feel it, tense it, and now slowly let it go as your left hand is pulling you back down. Let your eyes look down the direction you're headed. When you get back down there, let your hand come across to the opposite hip. All right, one more time. Switch your hands, right hand, left shoulder. Your eyes are going to lead first. Look down, breathe, begin to exhale. Keep your sit bones even. Reach across, look down to your hip. And now let your eyes come up, let your head follow. Let your scapula and your shoulder blade follow. Bring your arm up, reach, pull, pull, pull. Feel it, thank it for all the hard work. And now eyes back down and let it travel across to the opposite hip again. Reach down slowly and then let your hand follow to that hip. Sit back up and notice. By now you're probably noticing that your shoulders are not as tense as they were and your jaw's got some space. All right, let's do it one more time. Grab the opposite side. You're moving through resistance now. You're not forcing, and you're following your eyes. Your breath is full. So now, slowly on the exhale, fold into the curl. Resist a little bit, right? Your hand is pulling over here. Pull down, eyes down, look down, roll down, even sit bones. Now, eyes up, look up, breathe up. Let your shoulder blade come back in your back pocket. Don't strain your shoulder, but reach back, arm back, look back, breathe. And now exhale, let your eyes follow back down. Let your arm come down, reach across, down, pull, 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 go slow. And reach to the opposite hip, and then come sit up. And now just feel the echo in your body. Feel that you've actually completed a circuit crossing the body. There is quite a difference, very likely, in those shoulders, especially if you pulled firmly. Feel how you're sitting. Probably the weight of your sit bones is different, but most of all, feel the ease in the shoulders and the neck. What you did is you engaged that chronic tensioning. You let it go into a contraction phase, and then you let it come out, and then you softly pulled it back in, and then you let it go. You also connected the left to the right and the right to the left side of the body. Notice the difference. It's a simple thing to do. It wakes up the upper back. Your breath is probably easier into the low back. There's so many simple things that come from doing these small awareness activities somatically for your body. So take a moment and share below. Where does your pain tend to travel? And after you did that movement, did you notice, like before you did the opposite side, did it really feel different? And if this feels different than stretching, it's because it is. You're not forcing length. You recalibrate tone and the length follows. So if this perspective resonates with you, please subscribe so I can keep the content coming. And let's keep working on this because we approach pain through regulation, not force. It's sometimes quite different than a lot of physical therapy approaches. So pain moving around isn't just mechanical. Stress changes tone. Overwhelm in your life increases bracing. Like fear can grip your belly. Frustration tightens your jaw. Your emotion and your muscles are not separate systems. If your life shifts, your tone shifts. And it goes both ways. Sometimes when neck pain resolves and back pain appears, something else in your life is reorganized too. Just pay attention because it's not in your head. Your nervous system adapts to everything that's going on. So I'll just ask you to consider gently if you're having chronic pain. What are you bracing against in your world right now? And can you be a little more compassionate with yourself, a little more kind? Because when you're kind and compassionate, you begin regulation. It's not collapsing. It's not giving in. It feels upright. It feels like support. Your breath reaches around to the back of the body. The jaw learns to rest. Your pelvic muscles become more fluid. The base of the pelvis more open. More supported when you sit and when you stand. And when your whole system feels supported, it no longer has to relocate tension. It brings the tension to your awareness. There's something you can do about it. So let's finish really simply. One more thing, right? Put your hands around your rib cage, thumbs in the back. Breathe into the low back ribs and let yourself move sideways, breathing in low back, exhale softly. Let your tongue soften, feel your feet. Rock the pelvis, inhaling forward and back. And now small circles, just easy. Let your tongue soften, feel your feet, go both directions. And let your body know you're paying attention, that you're there. So the primitive, protective part of your nervous system gets the message that you're paying attention. So this week, instead of asking, why is my back hurting now? Or why is my shoulder bothering me? Try asking yourself, what is my nervous system trying to balance? And what can I do to give voice to the tension? Because pain that moves is often the protector part of ourselves reorganizing. You are not broken. Your system's been adapting. And when you stop chasing symptoms and you start listening to the pattern, listening to what's going on in your life, something shifts. It really works. So, if this reframed your understanding and you start to feel like, wow, there's something for me here, please like this video, subscribe to the channel. Tell me, talk to me. I check pretty regularly when people reach out. Where's your pain traveling? And next time we'll go into something deeper. Is your nervous system actually changing that pain on purpose? Until then, regulate before you renovate. You can't change things striving for change until you soften and you listen in. It's great to see you guys. Next time.